Well, you may have heard about the commercials. They run from time to time talking about a clinical trial.
But what exactly is a clinical trial and how could it possibly help you? Well, here to tell us all about it, Susan Angel and Sarah Fox from CNS Healthcare. Hello, ladies.
Hello. Good morning.
How are you guys? Good?
Good. Doing well.
Excellent. So tell us, Susan, for people who aren't aware, what is a clinical trial?
Well, a clinical trial can encompass different things, but in most cases it's evaluating a new medication, a new procedure, or some sort of new device to see if it's safer or more effective than what's currently available options for treatment.
Why would someone who's watching now, why do people participate in clinical trials?
Well, there's numerous reasons. Because some of the benefits of it are that you have access to the latest cutting-edge type treatments which you wouldn't have normally in your doctor's office. Secondly, the opportunity to participate gives valuable information and could help people down the road. Also, for those who don't have insurance or access to health care, it's another means to do that.
And Sarah, let's bring you into this because when we walk in the doors for the first time, we get to meet you.
That's correct.
Walk us through what happens when we walk in the door and where we go from there.
I would be the first person that you would see. Basically, when you come to see us, we talk for about 30 minutes. We go through some of the medical history as well as symptoms to see which of our trials are best suited for you. For some of our trials, we have specific assessments that take place at that initial visit for the adult ADHD, hypertension, depression. So at that visit, I would also conduct those assessments. And then from there, once we determine how we can help you best, then I tell you a little bit more about the study, the expectations, visits, various medications, medications you would be allowed to take versus not be allowed to take. That's about it.
Yeah.
So now, does somebody walk out of there that first day pretty much knowing if they qualify?
Yes, they do. That is the answer that they receive at the end of that visit.
Yeah,
and then
right. So they don't have to wait, which is
right,
a really good
right.
thing. And if someone qualifies, how do they get started? Do they start that day or do you schedule an appointment, come back?
At the end of their first visit, if they do qualify, then we set them up for their following appointments and go from there.
I mean, sometimes they could even start that same day if
Okay.
there was the room, so they could even see a doctor that very same day that they come in.
Yeah, sure, it depends on availability and whatnot. Okay.
Yep.
Now, there's so many different things that people come in for, like you said, ADHD, and it's such a diverse thing. What are some of the trials that you guys currently have going on?
We have numerous ones for mental health related issues such as depression, bipolar disorder, ADHD, both for adults and children. We also have medical related trials for people suffering from chronic pain conditions, lower back pain, as well as high blood pressure or low sex drive.
Oh.
Yes, oh.
Yes.
That's the only way I can react to that one.
You want to get a card or something? Sorry, anyway. So, but this is really a good option, like you were saying, for people who just don't have anywhere else to turn. They don't have insurance and they need some sort of assistance. But the great thing is they're just going to get a good once-over as far as evaluating their current medical condition when they walk in the door.
Absolutely.
Yeah. So let's talk about, too, if someone needs more information, what's the best way that they can contact you?
Well, we've got a wonderful website that gives you all kinds of information, even about different disorders and things like that. You have the opportunity to schedule there, but then you can also call into our office and get an appointment that very same day, or as soon as you can get in.
And the great thing, no insurance is required.
Nope.
There's no upfront fees or anything like that. And you guys have a free 30-minute evaluation the first time you come in, right?
That's correct, yes.
Yeah, and can you also, people receive stipend for their traveling and they can receive compensation?
They absolutely do. And for those that are enrolled in the study, there is a stipend. So, while you're helping us out, we can help you out there, in terms of gas and the time you spend.
And I just know that you guys have like a ton of stories, success stories. What is one that stands out to you?
I mean, well, you hear over and over again about people who don't feel like they're getting the proper care where they are. They're finding it hard to get into a doctor, just can't afford it. And then after they participated in it, there's been such a pronounced change in the way that they're feeling. I mean, it impacts their family, their ability to work, and it's just really turned things around for them.
And that's really what it's all about for you, isn't
Yep,
it?
It is.
Yep.
Yeah.
All right.
Excellent.
Well, Susan, Sarah, thank you so much for being here. We appreciate your insights. We also want to thank CNS Healthcare for sponsoring this segment.
To find out if any of their trials are right for you, just call 904-281-5757 and make an appointment for a free 30-minute evaluation session. Or you can also log onto their website, cnshealthcare.com. Remember, all of their services are free and no referral or insurance is needed.
Well, still to come.